everyone, and welcome to the FIPWiSE Initiative third podcast episode. My name is Renly Lim, and I am the Data and Intelligence Specialist here at FIP. It is my great pleasure to host this video chat with our four remarkable early career women today, Amanda, Renly, and Rayene. But before we dive into our conversation, let me paint a picture for you. So imagine a world where every woman in science and education has equal opportunities to thrive, where their voices are heard and their contributions are valued. That's the vision behind the FIPWiSE initiative, which was established on the United Nations International Day of Women and Girls in Science. One of our key initiatives is the development of a toolkit to create positive practice environments for women in science and education. This toolkit identifies 5 critical factors, including equal incentives for equal work, work-life balance, supportive and safe working environments, opportunities for professional development and recognition, and last but not least, women in leadership. So in this episode today, together with Amanda, Ladan, Renly, and Rayene, we will be exploring some of these factors and sharing real-life examples of equality and equity in action. So now, let's take a moment to get to know each other better first. So perhaps I will introduce myself first. So as I mentioned before that I am Renly Lim. I'm currently working in FIP as Data Intelligence Specialist. But before that, I work in industrial pharmacist like for 3 months, but I didn't like it. And because I love like patient-facing roles, so I moved to the hospital and worked there for 4 years. So it's kind of like pharmacist is my passion. And I would like also to hear from such remarkable young woman today to hear about their passion as well. So perhaps I will start with Amanda. Amanda, could you introduce yourself?
Hello, my name is Amanda Cavness, and I'm a clinical pharmacy specialist at Children's Hospital of the King's Daughters, and my practice area is pediatric hematology and oncology.
Thank you, Amanda. It is great to know that you are also a clinical hospital pharmacist, so we can talk a lot today, I suppose. Thanks for sharing. And I will move now to Renly. Renly, would you mind to introduce yourself?
Hi, firstly, so thank you so much for having me, Shelly, and it's really good to see you again. And hi, everyone, I'm Renly Lim. So I grew up in Malaysia. I completed my pharmacy undergraduate in the UK. And then I worked as a clinical pharmacist for a couple of years, but then decided to do a PhD. So about 8 years ago, I finished my PhD and moved to Australia. And now I'm working as a full-time senior research fellow at the University of South Australia in Adelaide. Thanks.
Thank you so much, Renly. It is great to have someone else within the Western Pacific region as well, and also with the clinical pharmacist background. So thank you so much for coming for today's episode. And perhaps I would like now, Rayene, would you mind to introduce yourself?
Sure. Thank you, Sherry, for giving me the floor. So my name is Rayene. I graduated 3 years ago from pharma school here in Algeria, and I have so much love and passion for associative work and the impact we have on other pharmacy students' lives and patients in general as pharmacists. And this is how I started my volunteering journey in the International Pharmaceutical Students Federation, to which I served as president up to last year. Career-wise, I have always followed the same call for serving and my belief that whatever we do should have a positive impact and an added value to our society, definitely contribute to the bigger picture. So that's how I ended up joining the team, establishing the Ministry of Pharmaceutical Industry here in Algeria, where I worked in a while on drug availability, especially during COVID, and then switched to Health Technology Assessment Unit. A few months ago, I changed my job actually to something that aligns more with my calling and what I believe I should be doing in life. So I'm now an operations specialist in Amex Vienna, Austria. What we do is we make sure that different NGOs like WHO, UNRWA, Doctors Without Borders, etc., have access to the different drugs and tools they need for their humanitarian missions. And for me, this is like the most part of this unique career that I chose for myself, is that it allowed me to discover how business as well can be a force of good, and how pharmacists' scope of practice can actually be extended in so many ways, and different career paths that we can take as pharmacists and as women in general.
Thank you so much, Rayene, for sharing your amazing work. It is good to know about early career pharmacy already make an impact. The way you mentioned about your work related to health technology and also about humanitarian. Thank you so much for sharing that. And perhaps, Amanda, do you want to share a little bit about your work to make it like, because I know that you are saying like clinical pharmacist, so I believe that you have more impact than that. So Amanda, would you want to share your work?
Sure. So my role is as an ambulatory pharmacy specialist, meaning I work in our outpatient clinic, and I see patients with all forms of bleeding disorders, hemophilias, clotting disorders, all of our oncology patients, and then our sickle cell disease patients, which I particularly love working with, and have gotten to really build that clinic from the ground up. And so I did my first year of postgraduate residency at the hospital where I work now. And I did a second year of residency specifically in pediatrics at Children's Hospital, or at Children's National Medical Center in Washington, D.C. And through those 2 years is where I really discovered my passion for oncology and the sickle cell disease population, and decided that is what I wanted to do. So I started at Phoenix Children's Hospital in hemonc and bone marrow transplant. And then when this position came open to be able to build this clinic and really develop the role of an outpatient pharmacist at this hospital, I knew that was something that I wanted to do. And so I've been able to work on expanding the pharmacist scope in a clinic, and been able to establish some pharmacy-led telehealth and like some pain management programs. And so I've really gotten to be hands-on with the patients every day, which I really love.
Thank you so much, Amanda. That's such inspiring. So today, in today's episode, we have many scope of practice. Like you were saying that you are advocating for expanding the scope of practice of pharmacists, and you're working in ambulatory and pharmacist-led clinic, which is amazing as well. And perhaps I would like Renly to also share her role a little bit more, so we can hear such inspiring stories from all of our guests today. Renly?
Thanks, Shirley. So I'm currently working full-time in research, and my work focuses mainly on developing and implementing solutions to improve use of medicines and medicine safety in Australia, particularly in older people. So in the last few years, we have written a few national reports, for example, to the Australian Government Department of Health, to the Pharmaceutical Society, for the Pharmaceutical Society of Australia, which is like the FIP equivalent, but Australian national level, where we found how much of an issue medicine safety is in Australia, and that kind of led to changes in policy nationally. For example, the most significant one being medicine safety being declared as a national health priority area, which was quite significant because the previous 9 national health priority area were all disease specific, so things like cancer, cardiovascular diseases. So it was kind of the first time when medicine safety was considered a national issue that needed to be addressed. And that came about from my work and our work at the university. I'm also working a lot in the aged care space, which I think in a few countries you call them nursing homes. So it's quite a neglected space here in Australia. And so I'm working a lot with the government to see how we can improve the use of medicines in nursing homes. Since becoming a mom, I am also particularly interested in medicine safety in children. This is kind of a side project, but I've just finished creating a children's picture book focusing on use of medicines, which will be published sometime in July, and I'm super excited about. And it's also in collaboration with the FIP Foundation. I guess my motivation has always been to make a meaningful impact on people's lives, and right now my daughter, I guess, serves as a motivation for to strive at work, because I really inspire her to be a good role model. Really inspired to be a good role model for her, which is why I'm also really happy to be on this interview today, because it's all about, encouraging women in science and education.
Thank you so much, Renly. That's a very inspiring hearing how you can advocate to Ministry of Health about the policy changes, and again about soon to be published a book for children. Being just a recent month as well myself, I will be the one perhaps who wants to read your book soon. So thank you so much for sharing that.
Thank you. I've got multiple buyers now. Thanks.
Okay, thanks, Renly. So one tech point from just discussing about getting to know each other, I can see like women in science itself, it has like a really diverse scope of practice, and we all can make an impact wherever we work. And perhaps now I would like to talk a little bit about a role model, because Renly just recently sharing her insight about being a role model of her children. So I may go to Ryan perhaps now. Ryan, how can you think like a woman be a good role models for pharmacy students who are yet to graduate and be pharmacists? And since you are previously a past president of International Pharmaceutical Students Federation, so I believe that you will have a lot of insight on this. Ryan.
Thank you so much. So I actually believe that each one of us has a direct impact on how the rest of the world functions. And we should never think that we're too small to make impact in the world or to inspire others. And we want it or not, everything has an impact, even non-action. Actually, there is nothing that has more devastating consequences more than non-action sometimes. I believe that the choices we make on a daily basis actually shape the world we live in, and the messages we put out there through our daily behavior, during our daily practice as pharmacists, will have an echo in people's lives and subconscious. Being maybe a positive role model for pharmacy students, in my opinion, starts there, from having that understanding that we do not exist in our own bubble, but rather we are part of the bigger picture, and our daily interactions with our patients, with pharma interns that we train, with colleagues in the profession, will have a direct impact on the way they perceive being a pharmacist and the way they think they should carry themselves throughout their practice or daily practice. Women being out there as caregivers and pharmacists in all different roles and positions do as well send a very noble message and have a huge impact on how the younger generation thinks of this specific career path. Like you can see here, Amanda sharing what she's doing on a daily basis, which is very inspiring and Renly. And I believe like sharing is where we should start, that we let people know what we are doing and how we're doing it. And then also showing them on our daily practice, like this is how we carry ourselves while being pharmacists. This is the kindness we put on our interactions with patients. This is the empathy that we put out there. And this will make them reflect and say, yeah, this is something that I want to do, or this is something that I see myself invest in a lot of time and energy to be able to serve the world in this exact way, or they would say, yeah, this is not for me. So this is something that I definitely believe like women are really good at. We are really good storytellers, and we can put the moral of the story out there in a more comprehensive way to the younger generation. Of course, again, as we carry out our day-to-day duties, we should not be cranky, or we try not to be or to affect the way the new generation would perceive being a pharmacist, because we want it or not, like our profession is hard, yet it has a lot of challenges, a lot of work to be able to be there, but then we enjoy it at the end of the day, and that is contagious. And people would be able to see that, and the new generations would want to be part of that message if we actually communicate it the right way. So yeah, I definitely believe women have really, really huge impact on inspiring other pharmacy students to be the best version of themselves.
Thank you so much, Ryan. So it's like what you're saying about like to become a role model. The first thing that we can do is basically to share our experience, and that's what we are doing today. So it's thank you so much for highlighting that. And perhaps I will go now to Amanda. As a clinical pharmacist, what do you think, Amanda? How can we be a good role model for pharmacy student or someone or pharmacists themselves, basically?
Thanks, Shirley. Yeah, a lot of times I really focus on practical things that we aren't taught when we are student pharmacists. So, talking with students, particularly female students, about how to advocate for themselves, how to present their qualifications and their accomplishments when negotiating for benefits at work or for an increased salary, when our pharmacy residents finish the program and they are out interviewing for different jobs and trying to navigate those situations of, well, this job offered me this, but this has better benefits, or, I don't think this is necessarily a fair salary. So, teaching them how to present the accomplishments and the qualifications, whether it's board certified or the things that they've done, how to present those so that they do get fair benefits and an equal salary. And then also just, how we care for and how we address our patients. And so, I mentioned I work with the sickle cell population. And so often there's a lot of stigma that surrounds sickle cell disease and the patients that have sickle cell disease. And so really just how I refer to them always as a child with sickle cell disease, a patient with sickle cell, and, not some derogatory comments or, terms that people use, such as, oh, they're a sickler, or we have another frequent flyer here. And so really just trying to show them how to take care of our patients with dignity and with empathy, so that they can be the best version of a pharmacist.
Thanks, Amanda. I can text points that I can get from what you're saying. So like how we can train our pharmacy student about how to present our accomplishment, to advocate for the decent work. So thank you so much for raising that as well, and how we can tailor our communication and our skills according to our patients. So it's like related to the cultural things as well. So thanks so much for sharing that. Renly, would you mind to also provide your insight about what do you think, how we can be a role model for pharmacy students and pharmacists?
I think Amanda and Ryan have covered everything beautifully. If I can think of another example, probably what I would normally do is just lead by example. So, for example, demonstrating all the good values that we'd like them to learn. A lot of it aren't taught in university, like what Amanda have said. So things like integrity, empathy, excellence, professionalism. I also really like advocating for lifelong learning. So back in uni, I quite naively thought that once I finish uni, I don't have to study or learn ever again, which was very silly. But now my thinking has completely changed and I don't ever want to stop learning. So I guess encouraging students to always be curious, seek new opportunities, continue to learn and continue to grow, because that's the way I think they will be able to offer more value to the society, and at the same time find that their profession is a lot more fulfilling. I also like sharing my career journey with students, especially young students or people who are not married and wanting to have kids, and all the sort of challenges that they need to face. So I find that sharing all these experiences with them, both successes and challenges, can really help young women navigate both work and life outside of work. But yeah, I think Amanda and Ryan have covered everything.
Thank you so much, Renly. Yes, sharing experience, kinds of like such a powerful tool. I would say it's what you all three doing that today. So thank you again for coming to this episode. I would like to ask questions, perhaps now related to the workplace, particularly about the decent work in the workplace. I will ask Amanda perhaps now. So Amanda, according in your workplace, what do you think a good definition of decent work for you?
I mean, for me, it's just being able to come in and have a positive work environment, and be able to work with my patients and be able to, I guess, have that freedom to make the clinical decisions that I've been trained to make. And so when I feel supported to do that and able to do that on a daily basis, for me, it's pretty simple for me. I feel like I'm not asking a lot at work. So,
But it's very inspiring. Actually, feeling supportive is something that that we all need, and it's kind of like, I think I totally agree with you. It is a final. It is one of the um like a positive practice environments basically in the workplace. So thank you so much for sharing that. Ryan, what do you think about decent work in your workplace?
Yeah, for me, it is definitely being able to reach your full potentials, because if you are in an environment where they do not, or it does not encourage growth or provide growth opportunities for their employees, then it is really like limiting, a limiting environment that will not allow you to breathe and that will not allow you to expand, and then you end up being miserable and hating what you're doing, and that would reflect on the way that you serve your community, or you carry yourself during your day-to-day tasks, because as I think as human beings, we always strive to grow and get better and looking for the next step and try to have more opportunities and see or seek growth in general. And if the environment is not designed for that, it's not designed to provide us with equal growth opportunities as other colleagues, or because of your race, or because of your gender, or because of any other things, like, then you will not be able to give, you will not be able to be yourself. So for me, this is a very important aspect that I pay so much attention to whenever I try to choose my employer, if I may say.
Thank you, Ryan. So it's about like equal opportunities to get recognition and empowerment to everyone. So that's such a powerful tool as well. I will move to Renly now. Perhaps Renly, do you want to share your talk on decent work definition?
Yeah, sure. Thanks, Shirley. So I'm sure there's a more formal definition for what decent work is, but I'm currently reading a book called 80,000 Hours, written by a team of researchers, I think people based in the UK. So I think it's a non-for-profit organization. And to be completely open, I've got no time. So I've been reading it really, really slowly, but I was particularly intrigued by their definition of like a good job, which I think probably is similar to what decent work would be. And so they've had 3 key criteria, which is, first, it has to be work that ideally it's something that you're good at. Secondly, it's work that help others. And thirdly, it has a range of supportive conditions, so such as job security, fair pay, engaging work, supportive colleagues, and I think work that fit in with your personal life. So I cannot agree more with that definition, and that's kind of have become my definition of decent work. So, I want work that I enjoy and can help others, but at the same time, there has to be, a range of other things, like you're compensated fairly for your contributions. There's work-life balance. We have equal opportunities at work, regardless of, age, gender, race, ethnicity, and so on. And I don't also want to have to constantly worry about job security. So I think that kind of covers what I think is a good definition of decent work.
Thank you so much, Renly, for sharing the book as well. And from what you're saying, I was thinking like it is more or less similar with the factors that we have in the toolkit as well. The one that I mentioned earlier in the beginning of the episode, where our toolkit have like 5 factors about the positive practice environments, which is related to equal incentive for equal work, work-life balance, creating supportive and safe working environments, opportunities for professional development, recognition, and empowerment, and women in leadership. And I would like perhaps to ask Renly, from this factor, because you were just saying about the book, so from these factors, which factor that you think is the most important for you, and why, perhaps?
Thanks, Shirley. I think that all 5 factors are very important and we need to address all of them. And I guess prior to becoming a mom, I would probably pick factor 5, which is women in leadership. But since becoming a mom, my priorities have changed a lot. And I find that the most important factor for me and for you, maybe, Shirley, if I'm guessing correctly, is factor 2, which is work-life balance. So balancing my professional and personal responsibilities is a constant challenge for me. And a lot of it, I think, hinges on the amount of flexibility and support that I have. So in terms of flexibility, so I live far away from my family in a different country, to be exact. So we don't have a lot of help here, which means my daughter is in childcare on the days that my husband and I work. So we often have to adjust our work schedules around childcare pickup and drop-off times, as well as accommodate times when she is sick, which was quite often when she first started her childcare. And in terms of support, I guess we're just really fortunate here in Adelaide where we have easy access to good childcare. My workplace have very good parental leave policy. So I was able to go on maternity leave for a year, as well as just quite a lot of personal and carers leave days. So responsibility, time off that I can take if my kid is sick. So I think this type of support available to me does make a huge difference in my ability to maintain a good work-life balance, which I think helped me thrive professionally and personally. But it is a constant challenge, and I don't think I found a solution to that. But yeah, factor 2, work-life balance, is something that I think will really help with positive practice environments for women.
Thanks, Renly. I learned a lot actually from that. I suppose that that could be something that, yeah, I agree with you. When a woman like has child, then the priorities can be changed. And now, yeah, work-life balance, something that is very important. Thank you so much for sharing that. Ryan, how about you?
Well, I definitely echo Renly. I think this is definitely a major area that would allow women, to have careers and feel comfortable. Comfortable that is a job that would be supportive enough to adjust or to help women balance when they have children, when they want to have families. Work-life balance is always a topic that needs to be addressed. But maybe as the change, maybe then I would talk about creating supportive and safe working environment. Maybe I would take good practices from the work that I have now, or from the company that I work for, which has or is offering a lot of support to us that I think should be in every workplace. For example, they would offer us free mental health support sessions to all of the employees with professional psychologists, and I think this is a good practice that people can adopt, because it's very, very helpful, not only for the employees but then for the company in general. Because if the employees are healthy, their mental health is well taken care of, they are able to focus on their work and have more productivity, and thus the business will grow. So I believe there is nothing that would make a difference in a business as much as investing in the human resources well-being, and that can be organized in different activities, making sure that they have like a better social life. We have a lot of activities, for example, that are organized by the company between different colleagues. And we have soccer game, we have running teams, etc. So you get to see that a lot of companies all over the world are shifting their focus from just putting people to work, but yeah, like if you help people have a better quality of life and a better mental health conditions, then they are automatically happier, they're automatically more giving and more focusing on their jobs and more able to be productive. So this is something that probably the whole world is waking up to and giving more attention to, and that would help mostly women, because we are also like subject to microaggressions, a workplace, and sexual harassment, etc. So if you are like being protected from that, if you are provided with a safe working environment that is supportive enough, that is providing us with all the tools to be able to give and to reach our potential, then we're there and we're able to fulfill our mission in life. So this is also something that I wanted to address.
Thanks, Ryan, and thank you so much for sharing good practice from your workplace. It is good to know that like you said, like there are many workplaces now have such like a plan for having like a safe working environment. So it is really good, and thanks for sharing that the workplace that you are currently have like having like a free mental health support. That's a really important things as well. So that's a very good to know that there are some good practice where this is available for the employee. Amanda, how about you?
Thank you. So I know the other two briefly mentioned work-life balance, but unlike Renly and you, Shirley, I am not a mother, and so I really connected with the part of the toolkit that mentioned, women who maybe choose to prioritize their career. And so a lot of times I do face people who sort of act like I don't have work-life balance because maybe I'm not married or have chosen not to have children. And so really just sort of flipping the script on that and allowing women to make that choice to focus on their career. It doesn't necessarily mean that you don't have work-life balance, but just that that's something that you've chosen as a priority. So I really connected with that part of the toolkit. But so that we're covering more of these factors, I'll also briefly mention factor 4, opportunities for professional development, recognition, and empowerment. Because I do think it's very important to support females to be able to do things like be involved in pharmacy organizations and present the work that they're working on in their research. And so allowing them to feel supported. And I really liked the quote from the cases that were in the paper from Audrey Clarissa that says, women should not look down on themselves. They should be confident that they can contribute significantly at their workplaces. And, back to being that role model, I really always want our residents and our students to feel that and to know that you are trained, you've been highly trained to do these things, and never count yourself out. Always say that if there's something that you're interested in or something that you want to do, go for that. And so I hope that they feel that they're in work environments that support them and that allow them to do those things, and for them to choose sort of what work-life balance means to them.
Mm-hmm. That's very inspiring, Amanda. Opportunities for professional development, recognition, and environment is basically something that also very important. And you quote actually one of my colleagues, which is Audrey Clarissa. I suppose that after this, I will share with her that the quote that she mentioned is such inspiring, and we were discussing about that today, about how we can make sure there is open opportunities for our students, pharmacists, and employee, and in any workplace. So thanks so much for sharing that as well. That's a very insightful. Okay, so perhaps now I would like to know a little bit about the policy, the work specific for the gender equal health workforce. Since we're talking about how we can encourage women in science and education. So I would go to Ryan. Ryan, what do you think about, like, if there is any examples from your workplace, perhaps, about what policy or measure that we can adopt to make sure that we have a gender equal health workforce?
I would say definitely increasing the proportion of women in health and care leadership roles, which is something that as well the company I work for is paying attention to, sorry, which like I think what they are doing is keeping track of like the intent of or the interest of different employees in their leadership role and see how they can improve them. So they always have that annual development plan that would encourage women to take more leadership roles in the company, which our CEO is also a woman, so that's also quite inspiring for the rest of us. And that's something like I think all companies should have for their employees to help them have a clear development plan within the company. As well, I would say protecting women in healthcare against sexual harassment and violence at work, as well as microaggression, for example. I believe like having a clear system that fights against those incidents, or making it clear how to handle those situations and make it available for everybody to know this is what you should do. This is what microaggression is, because as silly as it might be, like, yeah, we say microaggressions, and then sometimes you're not able to define, okay, was that actually microaggression? Am I like, I feel very uncomfortable, but what can I do about it, right? So having a clear policy or clear guidelines on how to address those uncomfortable situations in the workplace is very, very handy for women in general. And I would as well say ensuring safe and decent working conditions for not only women but all health workers everywhere, while taking into consideration the specific challenges women might have when we design the system, because the system should be designed to meet everybody's needs, but not be designed for a specific gender, but everybody should have their needs met. And as Amanda mentioned, like, yeah, you have women who are choosing their careers as a priority, and that should be respected and should be supported actually, and taken as serious as it is. And then you have other women that might want also to prioritize like motherhood or having a family, and then you have women who would like to do both and balance it up, and the system should be able to accommodate the preferences of different women, in order for us as women to be able to contribute to healthcare in general.
Ryan, I think you kind of like covered many policy that we can do on that. I will see if, for example, Amanda or Renly, would you want to add anything from what Ryan said? Because I think Ryan already kind of like covered many policies that we can do to promote gender equal health workforce. Amanda, perhaps first.
No, Rayene, you covered it very nicely, and I don't think I could add anything to that to make it any better.
Thank you, Amanda. And Renly?
If I can add one more to it, to achieving gender equality, I think it would be addressing gender pay gap. I think generally women we know that women are consistently paid lower than men, regardless of country, company, level, profession, and so on. And even at my university, for example, where researchers are paid according to their level, so level A, B, or C, or D, there is often obvious disparity when women where men are always somehow at a higher level, when anecdotally we know that women tend to take on so many more responsibilities. So I think that there has to be an organizational culture or support from bosses, where bosses and supervisors need to actively encourage women to apply for jobs and for promotions, just because we know that women just in general are disproportionately burdened with household responsibilities.
Thanks, Renly. So what I can summarize from all three of you, basically, it is important to have policy about like how we can increase a woman in leadership and make sure that there is equal opportunities for women and also for the other as well, balancing the work life, and have a clear system about protecting women, particularly from like microaggression, like Ryan mentioned, and like last but not least, what Renly mentioned about how we can address the gender pay gap. So it's a very important discussion today, and thank you so much all of you for sharing your example and your insight. There's a really very insightful discussion today, and thank you so much for sharing all of this. I just want to say thank you again, and thank you so much all for sharing your valuable insight and experiences with us today. It has been an absolute pleasure to interview you all, a very such inspiring young woman pharmacists, and your perspective and also your contribution have been insightful and impactful. Not just, I believe that not just for young pharmacists, but also for our entire audience today. So it's only not for women, but also for the other workforce as well. And as we continue our journey towards this equality and equity for science and education, let's remember the importance of amplifying the diverse voices, like Ryan mentioned previously, and also how we can foster inclusive environments, like all three of you also mentioned today. We believe that together we can create a future where every woman has the opportunity to thrive and also make a meaningful contribution. Once again, thank you for joining us, and we look forward to continuing this important conversation in a future episodes. Take care, everyone, and stay inspired.